Hello guys, do you know that diabetes is one of the leading causes of death globally? And millions of people have been affected by this condition. So today in my video, we're talking about diabetes and the signs that you're approaching diabetes. Now let's dive into today's topic. What is diabetes? You can as well call it diabetes mellitus, but I'll shorten it as diabetes. Now diabetes is a chronic medical condition that occurs when the body is unable to properly regulate blood sugar level. You call it blood glucose level. Now, glucose is the key source of energy that is being used by the body. Now, insulin is a hormone that is being produced by the pancreas, which is this organ right here. So what this insulin does is to regulate blood sugar level. It carries the glucose from the bloodstream to the cell, which is now being used up by the body as what? Energy. So you'll be hearing me mention insulin consistently in my discussion about diabetes. Now, to types of diabetes, we have type 1 diabetes, type 2, gestational diabetes, pre-diabetes. Type 1 diabetes is an autoimmune condition in the sense that now the immune system attacks the insulin producing cells of the pancreas, thereby causing it to produce little or no insulin at all. Remember I say insulin is the hormone that regulates blood sugar level. So when there is no insulin or little amount of it, blood sugar level will not be regulated very well. Rather, it will not be stopped in the bloodstream. So that is it for type 1. People with type 1 diabetes have to take insulin every day in order to manage their blood sugar level. Then type 2 is the most common type of diabetes. Now what happens here is that the body is now resistant towards insulin, or when the body doesn't produce enough insulin. Now the third type is gestational diabetes. This one occurs during pregnancy. Then the fourth one is pre-diabetic. Now, individuals with this pre-diabetic their blood sugar are higher than normal, but it is not enough for them to be diagnosed with type 2 diabetes. And such individuals without intervention can even enter diabetes. But today we'll be talking about type 2 diabetes, the most common type of diabetes that affects individuals. Now, how does this come about? Remember I told you guys that in type 2 diabetes, that the body doesn't react well to insulin, like that the body is resistant to insulin. This means that even though there is enough insulin there, that it can't help to carry those sugar from the bloodstream to the cell where it is being needed by energy. And over time, the pancreas, which is the organ that produces the insulin, can't keep up with the demand of the body asking for more insulin. Hence, the reason why there will be high amounts of sugar in your blood system, because it is not being carried to the cell where it is being needed for energy. Now, to the causes of type 2 diabetes. Number 1 is obesity. Excess fat around this abdomen, around this area, can cause the body not to respond well to insulin. Reason being that fat cells produces hormones and some other substances that interferes with the action of the insulin. Number 2 is physical inactivity, that is lack of exercise, or you living what we call sedentary lifestyle. Those things can make you gain weight and make your body resistant to insulin. Number 3 is genetic. So a family history of diabetes can predispose you to having type 2 diabetes. Number 4 is unhealthy diet. Consuming a diet that is high in processed food, sugar, and unhealthy fat can make you gain weight. And you know what will happen? It will make your body not to respond well to insulin. Number 5 is age. The risk of developing diabetes type 2 increases with age, especially after age 45, because the body's insulin sensitivity tends to decrease over time as it increases in age. So the other ones are hormonal imbalance, you having sleep problem, like all these sleep disorders like sleep apnea, or if you find it very difficult sleeping, suffering from what we call insomnia. Then the last but not the least is chronic stress. Chronic stress has a way of getting your body not to react well to insulin because of stress, and how it does that is by causing hormonal imbalance. Now to the topic of the day, which is signs that indicate that you are approaching diabetes. Number 1 is increased thirst. We call it polydipsia, when the body is in need of more water because it is trying to see if it can remove excess sugar from the bloodstream. Then number 2 is polyuria, that is increased urge to urinate, especially in the night. The reason being that the kidney is trying to work itself out to see if it can remove sugar from your bloodstream through urination. Now, number 3 is increased hunger. we call it polyphagia. That is when your body is in need of food even though you have already eaten, because the body is not getting enough glucose needed to be used as energy. Reason being that the body is not responding well towards insulin, and those sugar are stuck in your bloodstream and not to the cell. Now, number 4 is fatigue, like when you are weak, when you feel lethargic, and the reason is because the body is not using the glucose effectively. Still remember that the glucose is still in the bloodstream, hence you'll be very weak. That is number 4. And then number 5 is that you will have vision problem. That's what we call blood vision, and the reason is because there is changes in the amount of fluid you have in your body, which will now affect the lenses of your eyes, leading to what? Eye problem. When I say changes in the fluid, it's because of the fact that you are urinating too much. Remember, one of the symptoms was polyuria, because you are removing fluid, so there will be imbalance in the fluid level, thereby affecting the lenses of your eyes. So that is how this one comes to play about. So number 6 is poor wound healing and frequent infection. How does this happen? When there is poor circulation. And how does poor circulation come to play a role here? When there is elevated amount of sugar level in your blood, it tends to damage the blood vessels. And once the blood vessels are damaged, there will be impaired blood supply to the organs. So when you have a wound, there will be not much blood supply to that particular side that you have a wound, which we know that good circulation helps in wound healing. So in cases where you have high sugar level, it will not happen. There will be poor circulation to that particular wound, causing prolonged wound healing. It will reduce your wound healing, and then you will not be having constant infection in that particular part of the leg. Number 7 is unexplained weight loss. Now, because the body is not getting enough glucose, which it wants to use as energy, right? Now, what it will do in this case is to start breaking down fats and muscle in your body to use it for energy. And you know, when the fats are being broken down and your muscles are being broken down too, it will lead to weight loss. You start having unexplained weight loss from nowhere, even though you have eaten and eating. Remember, the another sign is polyphagia, increased hunger. Even though you are eating and eating, it will still be breaking down your fat and your muscles, leading to unexplained weight loss. Number 8 is tingling and numbness, especially in the leg and in the feet. How does this come about? When there is an increased level of sugar in your blood, it will damage the nerves. And when it damages the nerve, it will lead to what we call neuropathy. When you have that damage of the nerve, you'll be having those sensations and numbness in your leg and in your feet. Most times, it will even lead to what we call diabetic foot ulcer. Number 9 is dark patches on your body. See this thing here? It is an indication that you are approaching to diabetes. So when you see these creases, this thing here on your body, just know that you are shifting to diabetes. Number 10 is irritability and mood change. When there is fluctuation in your sugar level, it will lead to mood change. You're happy this time around, the next minute you are sad. That is what it does. So that is it for type 2 diabetes and the signs that you're approaching diabetes. In my next topic, I'll be talking about the prevention, management, and complications of high blood sugar level if left untreated. Please, if you are new to this channel, I'll appreciate you subscribe, like, share, and comment. If you have any question, I'll definitely reply you ASAP. Thank you, and stay tuned for more topics. Bye.